AGH decided to bring IV compounding in-house because we were in the midst of shortages. As COVID was happening, we needed to compound medications on our own, have control over our inventory, and reduce our reliance on some of our 503B partners so we can truly focus on our inventory control, what we compound, have the quality and safety component of it, and manage our process. So that was the primary reason why we brought robotics into our health system. We chose Omnicell primarily because of the IV compounding service program. So we could have bought the device ourselves and done it ourselves. But that takes a lot of expertise, a lot of training, and we just did not have that. We didn't have the resources, we couldn't hire technicians, we couldn't hire pharmacists at the time, and it was just a turnkey approach with Omnicell where the robotic expert who is running the device would come with the program, along with our strategist, our advisor, and the entire team that would come and help support and make our program be successful. Some of the value-added services that the Omnicell team brings to AHN is really allowing us to compare our program to all the other robotics programs across the country that are using Omnicell, and helps us identify what NDC of the product should we use so we have the best yield. Beyond that, they also provide opportunity for the formulary toolkits. So if there's medications that we know we want to compound on the robot that we're unable to procure from 503B facilities, or it's just something we want to do for cost-saving purposes, we can partner with Omnicell to either do the study, or the study may already exist that Omnicell has paid for. And that's a laborious process that's already addressed and taken care of that we don't have to do. Financially and operationally, we have significantly changed how we have functioned over time. At this point, we're about 30% of our non-hazardous production, or 30% of our non-hazardous compounding happens through our IV robotics program, which is huge because that's one, less reliance on 503B facilities, two, less manual compounding, and we're able to produce ready-to-use product, whether it be an OR syringe or an IV bag, available to our patients, to our clinicians at bedside, ready to go. Financially, I think we've made a huge impact. Over the last 2.5 years, we have seen about $2.5 million in savings, essentially by insourcing a lot of the products. And that's a pretty significant, especially in today's day and age where we're looking for every opportunity that we can get from cost savings perspective and still provide that high quality, safety, efficiency, care for our patients. So that was a huge impact for us.